All right, good afternoon once again. Today I want to there is something I have noticed among all these people that call themselves nurses and midwives, especially those ones that likes conducting delivery. When I was heading one hospital, one private hospital like that, I suspended one of my nurses because of this thing I'm going to explain now. When a woman is in labor, that woman is in pain. That woman is passing through pain. In fact, her life is between um this and that, 50-50 chances. And this woman needs petting. She needs attention, she needs affection. She don't need you shouting at her. She don't need you scolding her. She don't need you hitting her. A woman in labor, I'm talking about. That woman needs love. That woman needs care. And that woman needs attention. She needs to be pampered because she's passing through pain. So I discovered that the people they employed in the hospital before I came, they were this type of nurses that when you are in labor, nobody send your papa. And fortunately, your delivery comes and they ask you to push. You know how it is. And you are wasting time or you are screaming, they will hit you. In labor, they will hit you. So the first day I noticed that, I called for a meeting and I told them, I explained the physiology of labor to them. 46 decibels of pain, go and Google it. A woman in labor will pass through. Against 4.6 decibel of pain a normal human being should have, or 4 decibel of pain. So I called them and explained the physiology of labor to them, that you don't hit a woman in labor. Those actions they are taking, consciously they will not do it. Those things they are doing, there are some things that a pregnant woman or a woman in labor would do. You have to ignore or overlook because that woman is not doing those things intentionally. It is as a result of pain. And do you know the most annoying part of this? The people who will hit them, the people who will shout at them, the people that will scold them are women that has given birth to children, women that have carried pregnancy, that knows how labor pain can be or could be. They are the most ones that will shout at these ladies. Yes, when the young nurses do it, sometimes I ignore because one, they may not know the physiology of labor. Two, they have not gone through that part, so they won't know. But even if you've not gone through that part, some of you will have menstrual cramps. You know how painful it could be. Some people will have severe menstrual cramps that they can't even get up, they can't even do anything for themselves. Then multiply it by 20. That is a woman in labor. So I told them, you don't do this. After explaining the physiology of labor, they answered, okay, ma, thank you. So I left. I visit that hospital 3 times in a week. So that day I went unannounced outside my days of visitation. When I got there, a woman was in labor. Meanwhile, I go to conduct antenatal classes for them. It's a non-governmental hospital, so trust crowd for antenatal. So they were like, when I come, they will say, ma, I want you to be the one to conduct my delivery. I will now ask them, I will tease them, what if it happens to be the day I won't be on duty? They say you will be on duty. So that fateful day, I went to work unannounced. From the gate, they were coming. Patients outside, they were happy to see me. These nurses were in the labor ward conducting delivery. So by the time I entered my office, dropped my bag, I heard, Madam, can you? Hey, I was like, what is going on? They said they are in the labor ward. I quietly opened the door. The nurse have raised her hand, whether she want to slap the woman or she want, I don't know what, but she raised her hand with anger. If you see her face, if you are in labor, labor will not come. So immediately she raised the hand and I opened the door. The hand was hanging and I told her, slap her. Slap this woman, let me see now. So the woman, on seeing me, oh, she screamed with this kind of relief. Thank you, ma, because you are here. That alone made her spirit to come back. So when I told that nurse, oh yeah, slap this woman in my presence, let me see how it used to be. She started apologizing. Trust me, I took up the delivery there and then and suspended the nurse. What am I trying to say? My fellow colleagues, whether trained or untrained, as long as you are putting on this uniform, this represents purity. In fact, when you wear this uniform, you should wear the Spirit of God in you. The fruit of the Holy Spirit should be seen in you. Igadiri humble, Igadiri empathetic is one of the good qualities of a nurse. You must be empathetic. That pain that patient is feeling, assume it is you that is feeling the pain. All right? So that woman in labor needs your attention. She needs care. She needs affection. She needs protection. When you shout at a woman in labor, one of the things it causes is prolonged labor, because there will be a chemical messenger that will be released and that will inhibit contraction, and that delivery will be prolonged. That labor will be prolonged. That is what. Someone called me from, not called me, I worked in government hospital. That's where I resigned from. So one day I went to visit in emergency pediatrics unit. They have reshuffled the nurses there. My sites there were wonderful. So they brought these grandmas. When I got in there, imagine emergency pediatrics ward, a baby was on IV fluid. The three nurses, grandmas, were sitting on the table discussing. The patient relative was calling them, "Ma, this drip is not going again." They shouted at her, "Madam, why are you touching it?" I was like, is this the EPU I left few months ago? Why? What is all this? So all these informations I've been getting about our nurses are all true. Go to FMC. You will see Shege Promas. I want to appeal my professional colleagues, those who are not my professional colleagues but wears white, please be empathetic on your patients. Remember, the hospital bed is not for anybody, but it is for everybody. You may think that you have given birth in the past, oh, nothing concerns you with delivery. Remember, your relatives will one day go to the hospital, and who will attend to them? People who are wearing this uniform. I am appealing to my professional colleagues. This stigma about nurses, this negative report about nurses is getting out of hands. You don't shout at your patients in labor. That's why patients most times will leave government hospitals and go to private hospitals where they can get succor, where they can get attention, where they can get this affection. You don't subject a woman in labor in fear. Make that woman your friend. There is one of my senior colleagues that passed away. Auntie Fee is what I used to call. I worked with her in Vadin for some weeks before I moved down to government hospital. That woman, she is just an epitome of Florence Nightingale. She's just a representative of Florence Nightingale. People that knows Auntie Fee, late Auntie Fee, will understand and attest to what I just said. If you are in labor and meet her, you will feel like coming to give birth 1,000,000 times. I always tell my nurses, if you are working with me, if I meet you in the labor ward and you are hostile to your patients, you are disqualified. No matter how beautiful you are a devil. Please, let us bring back what Florence Nightingale taught us. It's a compassionate profession. If you don't have compassion, you don't want wearing white, you better go and wear black. So please, if you have been offended in labor, if you have been maltreated in labor, I want to apologize. Please don't generalize the stigma or these bad reports on nurses. We still have angels. We still have people who are God-fearing, who have this calling. They didn't just come because it is nursing. I love you all. I'm still Nurse Berry. Thank you.